Chapter 16 covers our gypsum and wax products. The learning objectives for this chapter are to differentiate between negative and positive reproduction, to differentiate among diagnostic casts, working casts, and dyes. We will describe the chemical and physical nature of gypsum products and explain the manufacturing process for gypsum products and how this affects their physical characteristics. We will compare the following properties and behaviors of gypsum products, such as strength, dimensional accuracy, solubility, and the reproduction of detail. We will list the American Dental Association recognized gypsum products and their most appropriate uses. We'll explain initial and final set of gypsum and the factors that affect setting time, setting expansion, and strength. We'll explain the procedure for mixing and handling gypsum products to create diagnostic casts, identify the common components of dental waxes, compare properties of waxes. We will describe clinical laboratory significance of each of the waxes and discuss 3 classifications of waxes. We will differentiate between direct and indirect waxing and identify which property of dental waxes is most important in their difference. We will describe the usual color, form, and use of inlay, casting, base plate, boxing, utility, and sticky waxes. We will talk about prepared model plaster or stone when pouring up impressions. We will discuss the pouring of the anatomic portion of maxillary and mandibular diagnostic casts, how to trim maxillary and mandibular diagnostic casts, obtain a bite registration, and using that bite registration or utility wax. So we'll first talk about the uses and desirable qualities of gypsum products. First of all, gypsum is a mineral that is widely found in nature. It is ideal for making replicas of patients' mouths. These replicas are either called diagnostic casts, which are also known as study models, and these are used typically for patient education, going over treatment planning with a patient, and tracking progress of a patient, and that we see this a lot in orthodontia. Working casts are also called working models, and those are used for the fabrication of indirect restorations or prosthesis, such as crown and bridge, removable partial dentures, things like that. Dyes are the replicas of prepared teeth that are actually removable from the actual cast. What we're looking at here is an impression, and an impression is a negative reproduction of your patient's mouth. And when we pour that in stone, and in this case they've used plaster, it gives us a positive reproduction of those teeth. Some of the properties and behaviors of gypsum products are the chemical properties. The mineral gypsum is actually a dihydrate of calcium sulfate. This mineral is ground to produce a powdered hemihydrate, and when mixed with water, it becomes a flowable mixture. When that mixture happens between the water and the hemihydrate gypsum, there's an exothermic reaction where heat is given off as the material hardens or cures. There are different dental plasters, and they're all formed differently based on how they're processed. So if the mineral is heated in a big open vat, and they heat this to approximately 115 degrees Celsius, the hemihydrate is a porous, irregular powder. So this is model plaster. It is weaker. So now if we do this, take that same mineral, and a process is now done under pressure in the presence of steam and at a higher temperature, it will create a more uniformly shaped and less porous hemihydrate, which is dental stone. And with each one of these processes, that stone or that hemihydrate becomes a little bit stronger. So the third process is an further increase in pressure and heat, and that produces dye stone, which is very strong. Here are some study models. These would be diagnostic casts or study models. They're poured in plaster. Plaster is typically white, and you can see how they have a base to which the anatomic portion can sit on, and these are really great for patient education because you can actually show a patient how their occlusion fits together and kind of give them an idea of what you're trying to achieve with whatever treatment that is that you're presenting. So physical properties. The main differences in physical form will depend on the size and shape and the porosity of the powders. So like we were saying in the last slide, it depends on how those powders are processed, whether they're under heat alone or whether they're under heat and pressure. And then once that heat and pressure is increased even more, it makes that hemihydrate even stronger. So the strength, hardness, and resistance to abrasion, all of these have a different strength and hardness and resistance. So the strength of the gypsum products is related to the amount of water used to produce the study or working cast. So if you mix your gypsum product with a lot of water and it's thin, you're going to have a weaker mix or stone. So it's important to get an idea of the consistency that you want to produce a strong study model or die or working cast. The setting expansion is something that we have to think about with these gypsum products. Plaster has the highest rate of expansion, which makes it the weakest, and stones, the different levels of stones have the lowest rate of expansion. So we also need to think about dimensional accuracy. If we can control that setting expansion, we can increase our accuracy, dimensional accuracy with that product. And that's mainly controlled by the water to gypsum ratio. Reproduction of detail. If the greater porosity of the final gypsum product, the less surface detail is produced. So the less porous a stone is, the better the detail. And how soluble a gypsum product is. So this would be directly related to that porosity. The more porous something is, the more it's going to absorb water. So models should not be exposed to water for long periods of time because it will weaken them. So the different classifications of gypsum products. Impression plaster is type 1, which is rarely used today. Model plaster, type 2, is typically that weaker white stone or gypsum product that we see. This is frequently used for diagnostic casts and study models. It's durable, but it's a relatively weak material, so we use that mainly just for those study models. Dental stone is typically what you'll see in the application that a dental hygienist or even in a dental office, many times if you're just making bleach trays, night guards, fluoride trays, things like that, we typically use dental stone, which is type 3. This is ideal for full or partial denture models or orthodontic retainer, whitening trays, and sport guard models. Then again, as we go up, they become stronger. They're manufactured a little bit differently. So now we've got dental stone of the high strength, low expansion type, which is type 4. This is often referred to as die stone or densite, and it is used to fabricate crown and bridge work, so more detailed, less porous. And then dental stone high strength, high expansion, type 5 is good to use with newer base metals because of the casting shrinkage. This is what a die is. So you can see that the stone is very strong and you can take out each specific tooth, and in a lab they can fabricate a crown for just that tooth, and then they can articulate those together with the opposing teeth and the proximal teeth. So as far as the manipulation of these gypsum products, we also need to, the doctor typically will need to select the proper material for the application that he's using this gypsum product for. So whether you need a high strength stone or whether you're just making study models to go over a treatment plan, you would choose a higher strength, more detailed stone for crown and bridge than you would for orthodontia treatment planning. Proportioning, like I mentioned, is very important. Water should be measured with a graduated cylinder, and powder should be weighed on a scale. You don't see those a lot typically. I guess as we've gone along, we've gotten to where we can eyeball things when we're working in an office, but the true accurate way of proportioning your water to powder is to use a weighed scale to weigh that powder. Too much water will make a mix weak, and too little water will make the mix not flow, and it won't produce a good reproduction of your impression. Mechanical devices can also be used to control the spatulation of the stone when it's critical. We want to control setting times too, and if you need more working time, you can alter the water to powder ratio. You can use colder water, will slow down the set just like it does with impression material. The faster you spatulate the material or mix it, that increases setting time. So they can also place accelerators and retarders within those powders, whether it is impression material or gypsum products. They have accelerators and retarders that can speed up or slow down that process. So first, they recommend that you add water to the bowl and then sift the powder into the water, the gypsum powder. Mix with a broad spatula until smooth, which takes approximately 1 minute. At this point, your working time begins. So during this time, that mixture would be slowly poured into the impression with the help of a mechanical vibrator. You would hold your impression on the vibrator, and with little bits, you're going to let a little bit of that gypsum mixture flow down into the anatomy of that impression, down into the grooves and cusps of all of the teeth. You've got about 5 minutes of working time, so you've got a fair amount of time to do this. It's important too that your impression is dry. If you have some compressed air, you've had it disinfecting and wrapped in a moist paper towel and probably in a baggie. So you want to take some compressed air or air from your air water syringe and kind of dry those areas out, because that water will mix with your gypsum product as it's flowing down into the teeth and weaken it. So you'd like to start with a dry impression. So as viscosity increases, the characteristics will be decreased and the product loses its glossy appearance. So as we flow that material down into the teeth, and you've got all of the air bubbles vibrated out as you're doing that. Once the anatomy is covered, you can start adding the gypsum mixture in larger quantities into that impression. That loss of gloss that we see would be indicative that the gypsum has reached its initial set. Its final set is not reached until the material is hard and cured completely, and we no longer feel that warmth. That exothermic reaction has stopped and the material has cooled completely, and typically this takes around about an hour for it to run its course. So we'll talk a little bit about fabricating and the trimming of diagnostic and working casts. You will not be required to make study models, but you will make models for bleach trays and night guards, which is very different than a study model. With the study models or diagnostic and working cast, you've got two components to that model. You've got the anatomic portion, which is the replication of the hard and soft structures of the mouth. So again, you're going to pour by vibrating small increments of flowable gypsum into those duplicated oral imprints, and you're going to let that move from one tooth to the next very slowly, letting little amounts fill up that anatomic portion. The art portion will aid in handling and articulation of the cast. So that's basically a base that we pour, and we have base formers that you fill with stone, and those are pretty simple. You just fill them with large increments of stone with it on the vibrator so that it will get rid of any air bubbles within that material. You can do diagnostic working casts, either a single pour method or a double pour. A single pour method is where you pour everything up at the same time and you fill the impression side, you fill your base former or make your little mound of stone that's going to become your base after you trim it, and you do it all at one time. The double pour method is where they're poured separately, and then at that point you have to score the bottom of the anatomic portion and set it on top of your second pour, which was going to be your base, so that they will attach to one another and make them strong. Here are diagnostic casts, kind of a cartoon drawing of what we're talking about. You can see that on the maxillary model, you've got your art portion, which is that base. That's what kind of makes it pretty and gives it something to sit on. All of these angles are trimmed to certain degrees, and everything should be parallel and occlude together, and you can see how this works. The pink underneath the maxillary is representing a wax bite, where you have your patient, typically it's an arched shaped piece of wax, and we have them bite down with their normal occlusion, and then that is kept between the teeth to keep that diagnostic cast in their normal occlusion. So for storage of gypsum products, obviously it can absorb water. So we need to keep this in a dry, cool environment. So they should be stored in an airtight, moisture-proof container. For cleanup with gypsum, it is very important that as soon as you're done pouring up your stone model, that you dispose of the excess in the trash because it will clog sinks. And then you rinse the residue with lots of water down the drain. If this is allowed to stay in bowls or on spatulas or on the vibrators, it is very, very difficult to remove. So we cover the vibrators in our lab with plastic headrest covers to protect those and keep those looking nice. Spatulas and bowls need to be rinsed out as soon as you're done mixing. So as soon as that's all done and loaded and you've dumped the excess in the waste can, then you'll want to clean that up right away. Infection control is an issue with this as well. We want to practice routine disinfection of our impressions as well as our casts if necessary. So if the impression has not been disinfected long enough, or if there's any doubt about cross-contamination, you have to wait for 24 hours before the actual cast can be disinfected. It will affect the gypsum, so you need to wait 24 hours for that to completely cure, for that final set, and then you can spray the cast. It should never be submerged in disinfectant. Separating that impression from the cast is somewhat easy. You need to be gentle so that you don't break any teeth or poke or cause any scratching on the stone model underneath that impression. So you're going to gently ease a lab knife under the impression tray and lift the tray slightly in several areas. Then you want to take care and be very careful not to tilt that too far one way or the other way, because you could break teeth off. In trimming the cast or study model, those bases should be soaked in water for about 5 to 10 minutes. The base should be, not the art portion. We don't want to weaken the art portion. So if you were doing study models, you would only submerge that art portion or that base. It makes the study model much easier to trim if it is wet. The art base should make up about 1/3, and the anatomic portion should make up 2/3 of the total depth of the maxillary portion and the mandibular portion. So each should be equal and uniform. When we're doing models for whitening trays, bleach trays, or athletic guards, they're trimmed down very differently. Their symmetry is not a concern. We don't want to pour a great big amount of stone for a base. We're going to trim them down into a horseshoe shape. On the maxillary, we will want the palate gone, and on the lower, where the tongue is, we'll want that part trimmed away, because they will be used with a vacuum press machine. And in order to achieve the suction necessary to pull that thermoplastic resin around that anatomic portion, we need those areas gone. Investment materials are a combination of gypsum and silica, and these are used to form metal castings through the lost wax technique. They are able to produce very strong models that would then allow molten metal to be poured into them. And I have a diagram coming up here that kind of shows how that lost wax technique is done. The composition and property of dental waxes. Melting range is important with a wax based on what you're using it for. There are a range of temperatures at which each component of wax will start to soften and flow. We're going to hit briefly on the different types of waxes that are used in dentistry. Typically, we use what's called utility wax. It's also known as ortho wax. Orthodontists will give it to their patients to cover brackets to help prevent trauma to the buccal tissue from those brackets in their mouths. The flow of waxes is important. Excess residue. If we are using wax and there's excess residue remaining after that wax is removed, it can create inaccuracies in restorations. We also want to think about thermal expansion. Wax will expand when it's heated and it'll contract when it's cooled. So it has this effect is greater with wax than that of any other dental material. There are 3 different classifications of waxes: the pattern waxes, processing waxes, and impression waxes. And then they come in different forms. You can see sticks, sheets, blocks, or even tins of waxes. This is an example of the utility wax. This happens to be red. In our clinic, ours is clear, and we use that to either extend our impression trays or to use along sharp edges of the impression trays and give us a little bit more anatomy up in the vestibular areas. So that is typically what we will use as hygienists. There's different pattern waxes. There's inlay wax. Inlay wax is used to prepare patterns for metal castings using the lost wax technique. There is casting wax, which is used to construct metal framework for partials and complete dentures. There is base plate wax, which is used to make occlusion rims and to hold artificial teeth to the base plates during the fabrication of dentures. So those are our different pattern waxes. Then we have processing waxes. There's boxing wax. Boxing wax is used, the name sounds like what we use it for. So it's used to form a box around your impression when a die is being made. So basically we're going to build that impression up and give it some walls to hold your stone. Utility wax comes in long ropes that are easily manipulated at room temperature, and you can adapt around your impression trays for individual impressions. That's what I was talking about. We use to give us more anatomy and to make it more comfortable for our patient. Sticky wax comes in orange sticks that at room temperature are very hard and brittle, but when they're heated under flame, they become soft and sticky. Typically, a dentist will use the sticky wax. The dentist that I worked for would use this when he was making dentures. Impression waxes, there's different corrective impression wax, and they're used in the process of taking edentulous impressions. That's the corrective impression wax. And then the bite registration wax is used to produce wax bite registrations for articulation of models. Many times they're these preformed wax horseshoe shapes. Now we can do bite registrations using the mixing gun. They squirt the material on the occlusal surface of the lower and just have the patient close down on that impression material. So manipulation of wax, softening of wax can be done with an even dry heat, sometimes just with warm hands, like with utility wax when we're forming it around our impression trays, or with a warm water bath, and sometimes by flame, like the sticky wax, brittle hard sticks. Those have to be used with a Bunsen burner and flame to melt. So we want to store waxes at or slightly below room temperature to avoid distortion. The lost wax technique I've mentioned a couple times in this presentation. There are some primary steps to the lost wax and casting technique. First, they pour the dye, and remember the dye is that little tooth that can be removed from the arch. Then they wax that dye, and then they do what is called a sprue, or spruing the dye. They'll attach the sprue to the base and invest all of this in a wax pattern. They then burn out the wax and cast the restoration for the final steps. And so here is our wax pattern in A. And you can see that the wax pattern has now had a sprue added to it. The sprue is that bottom arm. Then we place a casting ring, and the wax pattern is inside that, attached to the sprue, and they fill this with investment. Then the wax is burned off, leaving behind this pattern that is then filled with molten metal, and the sprue, it's removed from this investment, and the sprue is removed, and now you've got your cast. So in summary, gypsum products are used to produce diagnostic and working models of the patient's hard as well as soft tissues. Gypsum materials' properties of strength and hardness, setting, expansion, and solubility are directly related to the amounts of water used in construction, and it is very important for an RDH to understand these properties so that we can make good study models or models for bleach trays, night guards, fluoride trays for our patients.